to the Pharmacy Inspection Podcast, where we discuss topics related to sterile and non-sterile compounding pharmacy in an effort to promote compliance and increase quality. The Pharmacy Inspection Podcast is a member of the Pharmacy Podcast Network, delivering quality and meaningful conversations and discussions about our pharmacy industry and the critical role pharmacists play in our healthcare systems. Learn more at pharmacypodcast.com. Please welcome your hosts, Brian Prince and Seth DePasquale.
Hello to all of our compounding friends and colleagues, and welcome to the Pharmacy Inspection Podcast. This is a show dedicated to discussing issues and topics related to both sterile and non-sterile pharmacy compounding, as well as USP compliance, safety, engineering, and whatever else comes our way in the compounding world. It's been a couple of weeks since the 2018 Compounders on Capitol Hill Conference in Washington, D.C. If you were there, you know it was a good time, and I appreciate getting to meet all of you who stopped by the Encore booth to introduce yourself and let us know how much you appreciate the content on this podcast. It's always a pleasure getting to hear how our audience, appreciates and that feedback about the content that Seth and I are releasing here on this podcast. So thank you. Thank you for stopping by and giving us those words of encouragement. If you weren't there at this year's CCH, I do encourage you to join us next year and let your voices be heard. It's one thing to sit back and feel like there's nothing you can do to slow down this regulatory and government oversight. And yet, it's a bigger thing for you to get involved, both at a local level and a state level, and even at a federal level, which is the benefit of joining us at CCH every year. The Pharmacy Inspection Podcast was sponsored by Encore Scientific at CCH, and we extend our most gracious thank you to all of you, our good friends at Encore, for your hospitality. So thank you for inviting us into the booth. This week's podcast is also sponsored by Encore Scientific. And for those of you who have not had the pleasure of being introduced to this company, they are a company that values building relationships by having one-on-one conversations with their customers in an effort to help solve everyday challenges. Encore is an FDA-registered facility that manufactures and distributes high-quality, compendial-grade raw ingredients, buffers, bases, solutions, lab supplies, and lab equipment. I encourage you to give them a call today at 1-800-454-2304. This week's guest is Kim Kieffer. She and I were introduced through an industry contact a little over a year ago, and we have enjoyed a mutually beneficial relationship, which includes the exchange of knowledge. That's always my favorite type of relationships. She's a wonderful and intelligent person with a lot to say, and so we welcome her to the show this week. Kim, thanks for joining us. Please tell us more about your journey in this industry.
Sure. Thank you, Brian. My name is Kim Kieffer, and I've been in the compounding industry for almost 17 or 18 years now. I started with a compounding only pharmacy in Tampa, Florida in 2003. And there I worked as the operations manager, the technician. I did not come from a pharmacy background at all. I had been in graduate school and was really just looking for work. And happy accident, I ended up working for a very dedicated and knowledgeable compounder who really mentored me and taught me the thrills of formulation and all of the interesting bits. And I found the work really interesting and inspiring. And at some point, I decided that I wanted to be a consultant to help solve other people's problems, less so on the patient side and more so on the pharmacy side. And in 2003, I got the opportunity to become a compounding consultant for Spectrum Pharmacy Products. And I was with them for 7 years until there was a change of hands to the Letco. And then I was there for a little bit of time. And then I was with Freedom Pharmaceuticals for a little bit of time until they were purchased by Fagron. And then I was with Fagron up until just recently. And for Fagron, I was the director of their consulting department, but also their educational outreach. And we offered ACP accredited education for pharmacists and technicians, and also, of course, subscription-based compounding and technical support. So that's my background, solving problems for the industry and for pharmacists and technicians and compounders all across the U.S. And so that comprises about 15 years of my journey. And currently, I'm working for Empower Pharmacy in Houston, Texas. And there, I'm focusing more on government affairs, quality, and general just consulting support for their staff. So that's my story.
That's a great introduction, and I love how you said that, your job has been helping to solve problems, and which is probably the main reason why we started this podcast, is because there was so much questions out there. A lot of it is around USP, and so we wanted to talk about compliance, we want to talk about education, we want to talk about training, safety, quality, all of those things that they've generated and they've created conversations relentlessly in our industry. And so I appreciate where you come from in that. And so let's kind of steer towards USP, because I know you have a lot to say about that. USP, I think there's maybe still a little bit of confusion even amongst us professionals in the industry. Is it a regulatory? What chapters do we need to pay attention to? Is it just 795? Because we talk about 797, we talk about 800 a lot. So kind of give us your spin, or tell us about your focus, and where you want to kind of steer this conversation about USP.
So USP is an excellent reference tool for compounders. I mean, primarily it is a set of standards for drug manufacturing and drug manufacturing industry. However, USP really sees compounding as part of that. So since compounding under 797 or 795 does not necessarily involve following CGMP, which the USP guidance for drug manufacturing kind of goes hand in hand with, they've created some special standards, 795 and 797, specifically for compounding. However, those are not the only chapters that are really relevant to practice. And it even says in 795 and 787 that the compounder is responsible to be familiar with a number of other chapters. So, for instance, pharmaceutical dosage forms, 1151, pharmaceutical calculations and pharmacy practice, 1160, quality assurance, 1163, 1167, which is prescription balance and volumetric apparatus, calibration information, and there's others. And still, besides the ones that they name specifically in the chapter, and there are others that they name, there's information on dispensing, testing, quality assurance, even labeling. So this information is all there to be referenced. And when I was teaching courses and offering education, we would often ask our students, do you use USP? Do you have access? And some of them might have access to the pharmacist pharmacopoeia, which is specifically the chapters that are having to do with compounding or suggested chapters. And that's good. That's a good place to start. However, what you don't get in there are the drug monographs and all the other stuff. So if you're ever in the compounding pharmacy and you're scratching your head, what do I do about this? It's pretty guaranteed that if you look into the general chapters and then even more the specific chapters in USP, you can find an answer to your question. And sometimes they are more industry standard guidance, but that same guidance can open up worlds of understanding for us just in our compounding practice and further elevate our level of quality. So it's a great thing to have, and I think a lot of people don't necessarily want to have access, and I'm not selling the USP, but it doesn't cost very much per year to have a lot of seats available to use the USP. And they just opened a new platform, so it's much easier to use now, and there's just lots and lots of information. And one of the things that I have found exceedingly helpful over the years, especially when dealing with formulation questions or creating formulations myself, is the monographs. So USP has drug bulk monographs. It also has finished product monographs. It also has compounding monographs. So there's a number of things that USP has added in there. They're compounding formulas and they actually have a monograph for them and stability dating. So if you use those monographs, you can use that stability dating. And they're starting to put more and more of those in, and they're right in there with the other USPNF monographs. So that's some really, really good information to have access to, particularly for formulating.
So I know you're not promoting USP necessarily, but is that a subscription of some kind that you get all in one package where it's the USP monographs, USP compendium? How does that work?
It is a subscription. It's a year-long subscription, so you have to renew it. But what you get is an up-to-date USP, because as we know, it's always changing. They're modifying monographs and chapters. They're adding new things. So you're always able to see what's compendial, what's coming up in the future, and then it's just easier to access. Because if anybody's had a USP book, it's a big monster, and they'll still send that to you. And you can even get it. You could even get it on a disc if you wanted. But it's so much easier to just access when you get in, and you have a nice little database that you can query, which they had before. It wasn't as easy to query, but like I said, they just opened a new platform, and it's really nice. I personally have been using the USP like for the last 15 years, and I can't say there's many days that goes by that I don't get into it. Even in my current job where I'm not formulating necessarily, I'm still in there all the time looking up information. So I find it really, really helpful.
Yeah,
and worthwhile.
I have to admit that I'll get questions sometimes, and a compounder I can remember in the last 6 months asked me about weight variation with capsules, and I was like, I don't know how to do, I don't know how to figure that out, and I was like, I wonder if USP has a chapter on it. And sure enough, they do. So like now, just as a habit, I just Google USP and then whatever I'm looking for, and I sent that person the USP chapter. Maybe not what they wanted to just get a chapter from USP, but it's very handy. It goes through exactly what you need to do to kind of figure out all the weight variation with capsules. So. I personally find it really handy, and I'm now that we're talking about drug monographs, I'm getting a little dorkily excited about that, because I think I will get a subscription. In your opinion, like, why should the bulk drug monographs be of importance when compounders have the C of A from their API wholesalers? I feel like when we get the API COA, that should just be kind of good enough, I guess, But, when I started realizing that that's not necessarily how manufacturers operate, they will go a step further and run their own QA on it. How do you feel about that sort of disparity, and how do you feel like maybe the bulk drug monographs can help along with that?
So the C of A does give us some good information. I mean, it's telling you how it tested, and it should be telling you that it was suitable, of course. But I think it's a good idea, just as a general quality check, to take the C of A and check it against the monograph. Sometimes chemical vendors will list their chemicals a little bit differently. So within USP monographs, you might have a drug listed as, for instance, lidocaine hydrochloride. It's listed as lidocaine hydrochloride, but if you look into the monograph, it can either be lidocaine hydrochloride not hydrated or as monohydrate. Those are both acceptable under the monograph, and so you may have one vendor that lists the product as monohydrate and one that just lists it as lidocaine hydrochloride, but it might actually be exactly the same, and you would know that based on the level of hydration. But without being able to check it against, you might think perhaps that you had a different chemical. So it's good to have an understanding that chemicals can be titled a little bit differently, and there's some debate what is correct and what is not correct. So that's one thing. Also, too, if you have a change, like for instance, if you're qualifying a vendor, so it's the first time I've ever bought from this vendor, I think it's a good idea to like be checking the monograph just to make sure that you know that what is in there is consistent with what they're giving you and be comfortable with the information that's coming from those C of A's. Also, if there's a change, like I was saying earlier, and that means if your vendor for some reason switches their vendor, because a lot of these wholesalers that we get materials from, well, they're just bringing those in from the manufacturers themselves or other brokers. So a lot of times maybe one chemical is not available, so they have from that particular manufacturer and they have to source it from another place. So when there's a change, it's probably a good practice to just have a look at that C of A and see how it looks, because a lot of times what these manufacturers will do is, even if they're doing their own testing, which many of them do, they're still passing on the C of A that they got from their manufacturers, right? And then they'll keep as their own reference their verified results, but they're passing along what they're getting from their manufacturers typically. So it's good to have I think it's a good, just general best practice to have a look at those. Not all the time. I think in the new USP 797 revision proposal, they suggest that you always check it. And I think that that's probably will take a lot of time and energy. But I think if there's points at qualifying and at changes, that should be sufficient. But more than just that, there's tons of information in those drug monographs that help you when you want to formulate, right? There's just a ton of information there. Those monographs have molecular weights, chemical formulas, base salt conversions, and they have level of our water content, loss on drying. All of those things are needed when you're running your calculations, because if you look at each drug monograph, you'll find that it's going to have a different range for assay. And of course, your C of A is going to tell you that. But what it won't tell you, molecular weight, chemical formula, base salt conversion. Not that you couldn't look at that up somewhere else, but it's all contained right there, so it's easy to look at and pull information from.
Yeah, I've run into the situation where it can kind of bite you in the tail if you're not looking at the C of A very closely. From one manufacturer to the next, they're maybe going to have a different process for putting whatever API together. Loss on drying is going to be very different, and that sort of information. So, not only is it obviously really good idea to check out the C of A, but I like the idea of checking it against the monographs, which kind of sets the stage for the C of A in the first place. So, it just to kind of keep everybody on a level playing field and make sure everybody's doing what they need to be doing. But I've never really asked other compounders if they've ever done that. I can tell you that I haven't really compared the C of A against many drug monographs. A couple of the things that I deal with, I know don't have drug monographs, only because I'm in the veterinary world, which that has its own set of challenges and stuff. But is there anything specific that you feel like we should really be honing in on that maybe you have caught in the past, based on your experience with C of A's and drug monographs? Have you come across any that are inconsistent and that would be really critical if it wasn't caught?
I think the biggest thing I have seen, I can't think of a time when I've seen a monograph that differed from the C of A. I mean, I probably have, but I can't think of any at this point. But what I do see is sometimes people don't understand what's being presented on the C of A. Like, for instance, they'll see the assay is 102%. Okay, so they're going to do their calculations on that. Well, have you looked to see what it's based on, So is this hydrated? Is it on a dry basis? I mean, how is this chemical coming to you? And that makes a big difference in how you calculate. So if it's on a dry basis, well, then you need to see, is there any water content? And if that water content is going to significantly push you out of your acceptance range. So that's probably the biggest thing. And then there's other things like gentamicin or other antibiotics, right? They might be in a salt form themselves, but what is actually being assayed and the activity it's based on is based on just the activity of the chemical itself or the antibiotic or nutrient. And so that also can make a difference in how you calculate. So I think going into the monograph, and it will tell you exactly what is being assayed and what that chemical activity is based on. So that, I think, is the biggest one. And that, to me, is a really huge problem. I mean, you really need to know exactly what you're calculating on. You need to know if your drug has 11% water in it. That's going to make a huge difference in terms of how you handle it. So those are the big ones. When do I make the calculations?
Yeah. One of the, to give a specific example, is like levothyroxine or liothyronine, or one of those where they're fairly narrow therapeutic index drugs. A 1 to 5% error could actually mean something very big to the end user, obviously. So we had an issue. We got a different manufacturer product in. It wasn't testing to spec. And when we finally were like, okay, what's going on here? It came down to water content. So, that can make a huge difference, obviously. And, so why are some of those finished drug monographs so useful in terms of, like, talking about these narrow therapeutic index drugs? I would think that for those specifically, that would come into play even more so for them.
Absolutely. So yeah, finished drug monographs. I think these are incredibly helpful. Like, for instance, this very example of levothyroxine sodium is interesting because that one can have a very high level of water. So you want to make sure, because you're doing micrograms, you need to, like, every single calculation makes a difference and counts. So you would need to make sure you take that into account. You need to make sure that you take into account the assay range. And then the other interesting thing about that is that levothyroxine sodium, according to the finished drug monograph, is given as a levothyroxine, not as the sodium. So if you do all of your calculations and you don't remove the sodium, forgive me, it's liothyronine. Liothyronine is given as the base and not the sodium. So I take back what I just said. Let's change it to liothyronine as the example. Same thing, narrow therapeutic index, micrograms given, very, very tight acceptance range for the bulk material itself. It's 95 to 101%. So if you're at 95% assay and you have 4% loss on drying, which you can have up to that, you're already out of your acceptance range, right? So, and then if you don't make the base salt conversion and change it to, we're giving it as liothyronine instead of liothyronine sodium, it's going to throw off all of your calculations. And we know that it's given as the base and not the sodium because the drug monograph tells us. And then the other great thing about drug monographs is they tell us what the acceptance range is for potency, right? So for compounded products, we all agree that we're at that 90 to 110% variance, right? But when there is a drug monograph that's available in the USP that gives a specific range, we need to use that. And a lot of times we're making drugs that have monographs. So for instance, lidocaine oral solution, lidocaine topical solution, liothyronine, levothyroxine, thyroid. I mean, I can go on and on and on. They all have monographs and they all have different ranges. So it's not all 90 to 110%. For instance, with lidocaine products, a lot of them are 95 to 105%. Atropine sulfate products, some of them are 93 to 107%, whereas others are 90 to 110. So that's something else to keep in mind. And I think that helps us because sometimes we don't know, there's all these drugs out there like foamine citrate, for instance. Well, how is that given? Is it given as a base or is it given as a salt? Well, a lot of times the product monograph will tell us. And if there isn't a product monograph, another great way to figure out that piece of information is you can go into Daily Med or some other drug resource, and you can usually figure out how it's given. But not accounting or accounting for a salt can also make a huge difference in your final concentration of your final product.
Very cool. Even I've definitely learned a whole lot from talking to you today. This is an area that I just don't, as much as I, read some of these chapters, even the monographs, I've not really delved into any of that stuff yet. So, really good stuff to be picking up on. Any final recommendations or advice for maybe us to get started on looking more at USP as a reference tool, not just for 797 and 795 compliance?
Yeah, absolutely. So I don't know that it's a standard practice for everybody. We all know that I think by now we all have a pretty good idea that levothyroxine and liothyronine need to be extensively looked at, right? So they've got a lot going on with calculation-wise, but a lot of products have these issues, and they're all different. And since they're all different, you cannot just depend that one criteria will be for all of them. So I think as a standard practice, if you have access, and I know everybody's going to go and get access, is that when you have a new formulation to create, is that you start there. Start and look at the monograph and see how it's given. Is it given as the base? Is it given as the salt? Do I need to account for the water, or is it close enough to the acceptance range? Is it, and then from there, it sort of unfolds itself, and you just hear it calling you whenever you have a question in your mind. And I think the other thing to also remember is that there are finished drug monographs in there that can help you. They don't necessarily give you the formula, but they give you a general idea of how that capsule or solution is supposed to look like. And for injectable products, I think it's very helpful because in addition, it will give you pH and endotoxin levels. So those things are hugely beneficial and helpful in your process.
Yeah, sorry for the brief pause. I am literally, trying to, it's probably not the best time to be doing this while I'm talking to you, but I'm literally like on the USB website trying to get that subscription going. Well, Kim, I know your time is very valuable, so I don't want to take any more. We really, really appreciate you talking to us today, and such an awesome conversation. So thank you so much. And I think we might have to have you on again sometime.
Absolutely. Yeah, Kim, super informative. I'm sure the audience genuinely appreciates the, that technical aspect, which is always a goal that we have here, is to bring as much. So when people walk away from this, they go, wow, that was well worth my time. And so I definitely feel like today was extremely beneficial. So we'd love to have you on again sometime in the near future if you're available.
Thank you. I would love that.
Awesome, Kim. Thank you again. I actually did snag a subscription to USP&F. Speaking of USP, if you're someone who has a lot of knowledge in compounding or some facet of analytical testing, certification testing, microbiology, the USP is having a call for candidates for the USP Compounding Expert Committee. It would be a volunteer position for the 2020 to 2025 term. Their website is callforcandidates.usp.org. I'd like to mention that this is our 25th show. It's been so much fun. I hope it's been really informative for you. And thanks again to our sponsors this week and at TCH, Encore Scientific. Honestly, I have to say I'm impressed. I've purchased a couple APIs from them now, and it's been great to work with them. I need anything, I call Micah at Encore. We chat about horses because he's got some horses, and that's who I compound for. I get my order in, and it's awesome because I'm getting excellent service and I'm getting great prices on really quality material. Give Mike a call. He's my rep, and tell him I said hi. it'd be great if Micah calls me at the end of this week and tells me a whole bunch of people called up and said you said hi. What's up with that? His number at Encore is 800-454-2304, or go to their website and order online at encoresci.com. That's ENCORESCI.com. One other thing to ask them about is using a 3D printer to make dosage forms. They have a 3D printer that can print medication-infused gummies. At least that's just what I saw it do. It can make individualized dosage forms in an unlimited number of shapes. I've actually written an article for the IJPC about extruders, which was one of the ways 3D printers work. It was in their series all about 3D printing. Interesting stuff. Encore works with a company that makes the 3D compounding printer, Vitae Industries. I've seen it in action. It's really cool. I'll actually post a video below from CCH. Give Encore Scientific a call if you're interested, 800-454-2304. I want to get an in-pharmacy demo. I need that 3D printer. So thanks again for tuning in. We've expanded our reach. You can hear us on a whole mess of apps right now. iTunes, Google Play, iHeartRadio podcast, Spotify, finally, and the list goes on. So thanks for listening, and remember, if you have any questions, leave a voicemail right on the site. Email us at podcast@pharmacyInspection.com, tweet at PharmacyInspect, or messages on Facebook. Until next time, keep raising the bar.